Yeah, Premier Horgan. Just wondering how you're going to get people to stay in healthcare when we feel that we're overworked and underpaid, and a lot of people are getting burnt out and they're leaving, and it's really hard to keep people in the Fraser Health community because they're just leaving and quitting and going on to the next thing. So
healthcare is certainly one of the hot topics we want to cover with you now, Premier
Absolutely,
Horgan.
and that questioner nailed the fundamental issue. Where are we finding the people? And it's not just in healthcare, it's in every sector of the economy. You see it. You can't find a restaurant that's open for lunch because they can't find the staff. But in the healthcare sector, the challenges are compounded. And having just gone through from the admissions door to the post-op, to the treatment, and to the recovery, the people are extraordinary, but they are absolutely burned out. And so we need, the solution is more people. And that's the solution for almost every single one of the questions that we're going to talk about today, is we need to have a renewed focus on how do we get more bodies into British Columbia, into Canada, quite frankly, and it starts with immigration. I'm the son of an Irish immigrant. You guys came from somewhere else, or your ancestors did. Yeah. We are fortunate to live in a community that has been populated for thousands of years by Indigenous people. We come here from every corner of the globe, and we need more. If you look at Canada's history, successive waves of immigration have been the tool that governments have used to keep the economy going. And if we're going to continue to have a robust, publicly funded healthcare system, we need more bodies and we need to pay them fairly. I've been very aggressive with the Prime Minister, not to say it's your fault, because that doesn't help anyone. I'm saying Canada needs to be leading on a national strategy for human resources, because the needs in BC are the same as the needs in Alberta, in Ontario, and in New Brunswick.
But here's the thing.
So we poach from those places because we can pay a little bit more, and that's not going to help anybody.
People are mad, though. So many people don't have a family doctor. We've got ERs closing, we got wait lists, we have ambulances sitting empty because we don't have enough paramedics. It's like whack-a-mole. Everybody is upset, and it is like a fundamental right. You should have access to health care. People are really mad about this, and I know you've tried with the Prime Minister and been somewhat unsuccessful in getting the
completely unsuccessful.
Okay, all right. Well, let's talk about that, because could you not take some of the revenue, we've seen unexpected sort of surpluses in BC, and shovel it into the healthcare system?
It won't create more people. It will create more spaces. We can say here are 20 positions, but if there are not 20 RNs, if there's not 20 LPNs, if there's not 20 docs or nurse practitioners, then we can't fill the positions. So it's not about the money, it's about the strategy. And we need to create more spaces in our post-secondary institutions, and we're doing that. We're accelerating training for foreign-trained health professionals whose credentials aren't necessarily equivalent to ours. Instead of making them go through the whole thing again for 2, 3, or 4 years, we're compressing that. And that, of course, we should be able to do in the 21st century. We should be able to say, okay, this is what if you're at Trinity College in Dublin, these are the prerequisites, these are the outcomes. What's the difference between UBC and Trinity? And let's fill those gaps.
My grandmother was the doctor of physiotherapy in Denmark, and then was the hostess at UBC upon moving here post-war. So certainly that is a frustration piece that we hear a lot about, wanting to fix that. But also from the medical community, I know Lynda and I have talked about this a lot. We get a lot of DMs and emails, and we listen from, we hear from our listeners, from our viewers, who say there are things that can be changed within the system that are just archaic, old school. The amount of
pay GPs more, pay paramedics more.
I was going to say paperwork, like just the paperwork, like not even before the pay, but the duplicity in the paperwork. Like,
well, we do pay paramedics more, but not enough. And what we pay in rural BC
gap.
Is not the same as what we pay in urban BC.
And
so then we're sucking the trained professionals out of rural British Columbia to come to the urban centers where they can get a livable wage.
However, the paramedics are still paid 30% less than firefighters and police officers and nurses, and they make about $10 or $15 an hour less than paramedics in Toronto.
And that's not that much, but we're working on.
It's a big gap,
And we're working on that. But let's go back to the docs, for example. We're finally. And I've been involved in government for 30 years, and I've not seen a time when the doctors of BC are standing beside the health minister and saying we're working on this together. Not all doctors are created equal. We're not all homogenous. We all have our differences. Doctors fresh out of med school in UBC, we just want to be salaried. We don't want to have an office. We don't want to have overhead. fair enough, we'll start paying you salaries. But the doctors that have been in practice for 20 years bought a practice from someone else, and they say, I've got this stranded asset. If you just start paying me salary, who's going to pick up the cost of this office? Who's going to pick up the cost of my staff?
Right.
So we're looking at ways to have the province take on the costs of running the office and then going to salary or fee for service, but all docs don't have the same outcomes. And those at the end of their career, the 75-year-olds, thank goodness, who are still practicing.
Yeah.
And we've got lots of 75-year-old doctors. They're saying, well, I have this business that I built up over my career and it's worth nothing because there's no one to come and pick it up after I leave. So we have to manage all of those things concurrently and always being focused on patient-centered outcomes, because having just been a patient, I know that's the #1 issue for the people who provide the care. And the other thing I want to say, just before we get off this, is the collaborative nature of the healthcare system. Every workplace is challenging. Sometimes you don't like your colleagues, but in everyone I've seen in the healthcare system, they get up, they get to work, even for their staying on for their second shift, and they say, what are the problems? What are we trying to accomplish together for the people who we're serving? And you don't see that in politics, you certainly don't see that, and you don't see that in a whole bunch of other endeavors in the human condition. But when it comes to healthcare, the professionalism, the collegiality, and the focus on outcomes for the people that are right in front of you is profound. And I hold fast to that as the hope for all of us as we start to repopulate and compensate, quite frankly, appropriately to keep people in the sector, like our friend from the Fraser Valley.
Let's talk about gas prices, because they're crazy. I think they're like around $2.41 in Vancouver right now.
$2.41.9.
This is the highest,
just saying.
a record high in North America. People are mad. They can't afford it. They say the ICBC rebate, thank you very much, got me like a quarter tank. We see Alberta, Ontario giving people a break with taxes. Why can't we do more in BC to offset these prices and figure out why they're so damn high?
Well, we did figure out why they were so damn high. We went to the Utilities Commission when we came into government, and we did a thorough review, and the experts, nonpartisan experts, couldn't find 13 cents. And this was back when gas was $1.50 a liter, and we were saying that's outrageous, like $1 ago.
Yeah.
And they couldn't find 13 cents. I can't tell you what that gap is now. But I do know that government policy did not lead to a 30-cent increase this past weekend. That was the market. And, you know, the so-called socialist intervening in the market makes sense. But the reality is it's a commodity that we have to buy on the market. And the price for that product is now way up here. The taxes we charge provide us with the SkyTrain system that we have, which is pretty extensive and very well used. It pays to fix the roads that have big potholes in them. And those taxes would have to be found in some other way. So either we tax a fixed price. As the price goes to $2.41, we don't get any more tax for that. The federal government does, but not that I'm complaining. But their taxes are tied to the cost of the commodity. Ours are fixed. The TransLink tax is what it is, and it doesn't go up if the price goes up. It stays at that.
Right.
So as we've seen these prices go up, taxes have stayed exactly the same from the provincial perspective.
But I'm going to jump in here on the fact that it's not just the price at the pump, it is also the price on all goods and services that are moved by anything that is fueled by gasoline. Like,
and
is there a way to
inflation,
give a break? As the daughter of a single mother, I remember my mom trying to make ends meet while working at the hospital as a lab technician with 2 small children, trying to just put food on the table. I can afford the gas price the way they are now, touch wood. But there are so many people who just can't. They
Why
couldn't
can't
before.
we do like a 3-month tax holiday?
Well, it's not a holiday. It's a deferred. It's
but
a
we
deferred
also
tax.
know that the BC government is a bit flush in cash that you didn't expect to have in the coffers. Why?
Natural gas prices.
Well, great.
Because
if there's extra money.
we all of us, and not just government, but British Columbians are reaping significant windfalls from the increased cost of natural gas, not gasoline, but natural gas.
Right.
So that revenue is tied to the price. So we're gaining and benefiting as citizens from this inflation.
Is
but
there not
in
a way
that
to give
one
a
little
break,
area
though, to that one segment? Like, I don't know. This might be me in opposition going, with stroke of a pen, Premier, just like this.
Why didn't you fix that first day?
Is there not some way?
Because I think it's 75 cents, isn't it?
Per
in
liter?
taxes?
Well, that would include federal
All of
excise
them?
taxes.
Yeah.
That would include that. It could be. I don't know.
It's that high.
But ours includes a carbon price, which was unique in Canada. Now that's measuring up across the other provinces. But the challenge is we still need to build bridges and roads, and and electric cars need roads too. For those who say, no, we just have to stop the car economy, nonsense. We have to find cheaper ways to move people around. That means big investments in public transit, and we're doing that. It means trying to find alternatives. Our electric vehicle or our zero emission vehicle policy, we were supposed to reach a certain benchmark by 2025. We met it in 2021. So the people are voting with their feet. They're saying, how do I, what can I do to reduce the cost of gasoline? Don't buy it. Find another way to move around. Not everyone can do that. I can hear the Liberals already typing out their questions for question period. How dare you say that? Well, it's true. Try to avoid costs. That's a human nature thing to do. How do I reduce the impact? What can government do? We did that through ICBC. We found a way to put almost $600 million into people's pockets. It sounds like a lot when you say a big number. It's a half a tank of gas when you go to the pumps.
$111.17.
We're doing the climate action tax credit. That'll show up on people's, they'll get that in the mail or direct deposited in October. Yeah. And the family benefit, which is something we started, that's going to have a difference. Saving money on childcare offsets the cost of gasoline. So we're trying to find ways to, no tolls on bridges reduces the cost. Yeah. No medical services premiums reduces the cost. So we've done a whole bunch of stuff to bring costs down across the board. And then, but it doesn't matter because you're driving down the road and you see the number going up and up and up at the pumps.
Crazy.
And all of the other stuff is forgotten because you have to fill up your car to get to the hockey game, to make sure that you pick up Granny to get her to her appointments. So I get it. But we're trying to make as much of a difference as we can with a product that is an international commodity that's traded around the world.
I'm pretty sure people are not going to like that answer anyway. Yeah,
well,
but anyway.
Don't vote for me. Don't vote for me.
Premier John Horgan is our special guest. Coming up next on Steel and Vance, we're talking political polarization and what is next for the man who is leaving office as one of Canada's favorite premiers. Stay tuned.